All right, part 2 of the renal system. We're going to start talking about urinary tract infections. A UTI is simply an inflammation of the urinary epithelium following invasion and then colonization by some pathogen within the urinary tract. All right, UTIs are relatively common. I would imagine, I don't know what the exact statistics are, but women are probably going to experience at least one during their life, probably multiple. Women are more susceptible to developing a urinary tract infection. So the most common pathogens are E. coli and Staphylococcus saprophyticus, even though E. coli is going to be the number one causative agent. And doctors are actually going to assume that if you go to the doctor's office and you present with a urinary tract infection, they will give you medication to treat E. coli while lab tests are being run to determine what's actually causing it. At that point, the physician may call you, or a nurse might call you and tell you to change the antibiotic, because when they test for what bacteria is causing the infection, they will also do an antibiotic susceptibility test. All right, so most UTIs are going to be caused by bacteria infections, but you can see from this figure here that there are other factors that will cause a urinary tract infection. Here you have hemolysin that will damage epithelium. You can have different mechanisms that go on, different bacteria that get in. Here you have Proteus and Klebsiella. But really E. coli down here, contamination from the colon is going to be the number one reason. All right, the physical proximity of the exit for the GI tract and the entrance or exit, or however you want to look at that, for the urinary tract system are very close to each other. All right, host factors that will also help in the process of developing a urinary tract infection: kidney stones, diabetes, immunosuppression. If your body is immunosuppressed, then if the E. coli actually gets in there, it's harder for your body to fight it off. And let's face it, we've got bacteria that get into our urinary system probably quite often. That's why when you have to provide a urine sample for, say, checking for a urinary tract infection, they want a clean catch. So you urinate, you flush any bacteria out that may be trying to invade the urinary tract system. You flush that out with the urine flow and then take a urine sample from that hind flow. High risk for developing a urinary tract infection. You have a basic pH for the bacteria, right? High pH of the urine is going to minimize the growth of E. coli, minimize the growth of Proteus and Klebsiella. Low salt, and then low urea levels. High risk. So basic pH, low salt, low urea levels, and high glucose content. That glucose content is here with diabetes, with your body, with your kidneys dumping glucose into the urine. That just gives a nice environment for any bacteria that may have contaminated your urinary tract. Ample food and a good location. Low risk for developing a urinary tract infection. Your urine has a acidic pH, high salt. They don't like that. High urea and low glucose. It's just simply not a hospitable environment for bacteria. All right, so host defense mechanisms can be protective in terms of the mucus-secreting cells that line the urinary tract system. That mucus helps to slough bacteria out of the system before it can actually get hold on the surface of the epithelial cells within the urinary tract system. A longer urethra in men can be protective, and so the bacteria have a longer way to travel before they can actually get into the bladder and cause problems. So the short urethra in women, a risk factor for developing urinary tract infections. All right, so this is what's happening with E. coli. All right, the bacteria also can play a role in whether or not you develop a urinary tract infection if they have virulence factors. So here, this E. coli, you see fimbriae on the surface, those little hair-like projections, and it's these fimbriae that actually interact with receptors on the cell surface to allow for the bacteria to actually dock and take hold. Whereas if they didn't have the fimbriae, when you have the flow of urine passing through the system, the bacteria just simply sloughed right off and down out. Whereas with the fimbriae, they can dock and sit there. So if you are one of those individuals who pride themselves in not having to use the restroom very often, all right, maybe you urinate when you get up in the morning and then before you go to bed, you have a few issues going on. Big one is that you are not drinking enough fluid and that you are probably dehydrated. But the issue at hand would be that your urinary tract system is not producing enough urine to flush, constantly flush these guys out. And if they're not flushed out, then they can amplify. They're going to amplify if they get into your system. So you want to minimize the amount of bacteria cell numbers that are in your system, because they're probably always there at some low level toward the entrance of the urinary tract system. All right. So specifically, physicians use the word UTI. People use the phrase UTI, whatever you want to call it, pretty loosely. But you can have specific areas of inflammation. Cystitis is going to be inflammation in the bladder, and that inflammation is generally going to be caused by bacteria. If this is not treated, it may spread to the upper urinary tract system to affect the renal pelvis, the kidney, pyelonephritis. This is going to be an ascending infection, right, due to obstruction or urine reflux. And really those people who are at risk, premature newborns, their system just simply isn't functioning properly yet. Sexually active women, again, as I mentioned on the last slide, I believe, that there's just a very close physical proximity between the anus, the rectum, and the entrance of the urinary tract system. So if a female is sexually active, there's just a lot of physical activity. You can have accidental inoculation, so to speak. It's recommended that after having intercourse that a woman does urinate. I don't know, within an hour maybe. I don't know the exact time frame, but that simply helps to flush any bacteria out that may have been moved into the area accidentally during that activity. Recent urological exam, the elderly, and then recent stone passage. Symptoms: frequent, urgent, painful, hot urination, fever, back pain, cloudy or bloody urine. There can be issues of feeling bloated, and because of the fact that the bacteria replicate so quickly, you can actually feel relatively normal, say at 8 o'clock, but by 12 o'clock or 2 o'clock in the afternoon, you kind of feel like you've been hit by a bus, because you have high numbers of bacteria replicating and causing inflammation. Treatment, pretty easy, pretty standard, is antibiotic treatment. Now, you see in the notes that men are 30% more likely to die from complications. Yeah, quite honestly, in that nerdy sense, I think this is an interesting fact. Right? You don't think about men, you don't hear about men getting urinary tract infections very often. But when they do, it could be quite serious. But at the same time, women, it doesn't pose a risk of complications such that it will take your life, but there are some women who are prone to getting urinary tract infections, and they're constantly getting these. And it really takes a toll on their really quality of life. All right, pyelonephritis, mentioned on the last slide, just kind of a fancy name for an infection of the upper urinary tract system, while the bladder infection or cystitis is an infection of the lower urinary system. So, E. coli is still a major player, Proteus vulgaris, Proteus mirabilis, and then Pseudomonas, also an issue. Probably the Pseudomonas you'll find most often in a hospital setting, or after that pelvic exam, urological exam. And it can be acute, meaning that it comes on quickly. It's just kind of one of those random things that happens, or it can be chronic. And this is going to be persistent or recurring episodes of acute pyelonephritis that leads to scarring. Some reasons for the chronic pyelonephritis is that depending on what organism you have, if the organism is antibiotic resistant, it's hard to get the antibiotics in your system at a high enough concentration to treat it, to get the right one that the bacteria might be susceptible to. And then also these guys can actually do a good job at hiding. They get down into the mucus if, a variety of different reasons why the antibiotic might not actually get to them. Right, you don't want scarring to occur. Risk of chronic pyelonephritis increases in individuals with renal infections and different types of obstructive pathological conditions. Right, whether it's kidney stones, whether it's some other uropathy that is going on, that can be an issue. Alright, then real fast here, glomerular disorders, just simply disorders of the kidney. And how these are going to be presented are with a sudden or insidious onset of hypertension, edema, elevated blood urea nitrogen levels. And this is occurring because as the kidneys are damaged, there's going to be a decrease in their ability, the glomeruli, to filter. So then you have elevated plasma, creatinine, urea, and then obviously the reduced creatinine clearance. So the damage is going to be caused by decreased glomerular membrane surface tension and surface area. If there isn't the proper blood flow through the kidneys, then there's a decrease in the ability to actually filter. And then an issue or an alteration in the blood hydrostatic pressure. Increased glomerular capillary permeability, loss of negative ionic charge barrier causes a loss of plasma protein into the urine. So looking at kidney function, they look for protein in the urine. No protein, that's good. And then if your body is dumping a lot of protein into the urine, then what happens is you result in hypoalbuminemia. Alright, so that means that you have low albumin, the major player, the major protein in the blood, and that's going to decrease your plasma oncotic pressure, which is going to encourage edema.